So a typical spine looks like this. The head would be here, the hips would be here. There's 24 vertebrae. Between the head and the hips, the vertebrae are the bones. In between each bone, there is a disc. The disc allows for motion. Each vertebrae is designed to move in 6 directions, forward, back, side to side, and rotate, and all that motion takes place on top of the disc. Now, in between each vertebrae, there is an opening where the nerves exit off the spinal cord. So the brain's up on top. The spinal cord runs down through the inside of the spine. And then again, in between each vertebrae, there's an opening we call the foramen. And through that foramen, the opening, there is a nerve that exits directly off of the spinal cord. So the spine is designed to protect the spinal cord. The nerves in the neck go into the arms. So if you've ever had a pinched nerve in your neck, very often you'll have pain in the neck. Sometimes you'll have pain in the arm. Sometimes you'll have pain that goes down the hand. This is about sciatica. And the nerves in the low back are the nerves that make up the sciatic nerve. So the nerves in the low back exit out between the foramen and they go into that. So if you've ever had a pinched nerve in your back, you'll have pain in the back. Sometimes you'll have pain that goes into the hip. Sometimes you'll have pain that goes all the way down the leg into the foot. Now again, it's the sciatic nerve that we're talking about today. And the sciatic nerve exits out of 3 foramen. There's 5 nerves total, but 3 foramen out of the lowest part of your spine that form into one very large nerve. So the key to sciatica is what's pinching the nerve. As that nerve exits through that foramen, what is it that's pinching it? Well, it's the disc. 95% of the time, it's the disc. And when you understand the disc, you'll understand what makes our treatment different and better. So it's very important. This won't take long. But the disc is a lot like a jelly donut in the sense that the outside of the disc, there's a thick material. We call that thick material the annulus. Inside the disc, there's a jelly-like substance we call the nucleus. The nucleus gives stability to the disc the same way air gives stability to your tire. What does that mean? It means when the nucleus has the proper amount of flow of oxygen and nutrients, the nucleus is healthy. It means it gives stability to the outer wall the same way air gives stability to the outer wall of the tire. Now the nucleus is designed to distribute stresses evenly in all directions on the annulus. This is very important. So when the angle of the load of the nucleus, or the angle of the load on the nucleus changes, very often it'll force all the pressure into one portion of the annulus, and the annulus starts to break down. And as it starts to break down, what happens is the nucleus will push out, and as the angle of the load changes and the nucleus pushes out, you'll develop sometimes a little tear in the annulus, but that beginning phase as the nucleus starts to push out is what we call a bulging disc. Looks like this from the top. Now, one of the more common reasons you can have sciatica is the bulging disc, because the disc is going to bulge into the spinal canal, into the space where the spinal nerves exit. So if the disc is pushing in that area, you're going to develop a little bit of a pain in the back, but also the pain that goes down the leg. So as the nucleus starts to push out, the annulus pushes out further, you get a little bit of a tearing, and you get that bulging disc where you start to get a pinching in the nerve. Also what happens is the annulus can tear even further, and as the annulus tears further and the nucleus starts to migrate out, you'll develop what's called a focal point, which is a herniated disc. So the herniated disc will push into the space where the nerve is. Probably the most common reason people have sciatica is the herniated disc. So the disc has pushed back into the space and pinched that nerve, and that nerve then causes the pain that goes down the leg. Sometimes the disc will tear all the way through and the nucleus will migrate to the outside. That's called an extrusion. Tends to be a little bit more severe, but another form of a herniated disc is the extrusion. And sometimes the nucleus breaks off and starts to move up and down the spinal canal. This is very rare. This is called a sequestration. But you can physically see on the MRI where the nucleus is pushing out. That's kind of important. So what do we know? We know that the nerves exit out of the lowest part of the back, form the sciatic nerve, and they exit through what's called the foramen. And when that nerve gets pinched, very often it's the bulging disc, it's the herniated disc. But also what happens is the disc can start to break down. And as it breaks down, the nucleus can start to dry out. The nucleus is designed to have the proper flow of fluid so you get a healthy nucleus, but when it starts to get less flow, the nucleus starts to dry out. And as the nucleus starts to dry out, what happens is the vertebrae start to get closer together. And as those vertebrae start to get closer together, what happens is the opening physically gets smaller. So you develop a degenerated disc. The disc is degenerating as the vertebrae get closer together, and that's going to start to pinch that nerve a little bit. Also, what happens over time is that space, as it gets smaller, you'll start to develop what's called stenosis. So the disc degenerates and then the bone starts to degenerate. So what do we know? We know that the degenerated disc, as the vertebrae get closer together, will start to compromise the nerve as they come out. The herniated disc will push into the canal, causing a pinching of the nerve. Sometimes what happens is patients get sciatica in both their legs. Very often it's the result of a herniation on both sides of the disc, where the herniation is pushed into the spinal canal, pinching the spinal nerves. Okay, it looks like this. We had a patient with this not too long ago with a herniated disc causing sciatica in both their legs. Pretty large herniated disc. The bulging disc, as the disc bulges out, it's going to start to pinch the nerve. And again, as the space physically gets smaller, both in the foramen and inside the canal, that's called stenosis. Stenosis, you get pinching of the nerves in the canal, but you also get it inside the foramen. And you get that as a result of the disc. So if you have sciatica, very often you have a disc problem. You can't have sciatica without really having a disc problem. Now, some of the treatments that people try for this are anti-inflammatories. Typically, the anti-inflammatory, the goal is to sort of decrease the inflammation inside the space. Doesn't always work. Why? Because it's a disc problem. Okay? Sometimes you're targeting the inflammatory process with the anti-inflammatories, but it doesn't solve the disc problem. Same thing with physical therapy. Physical therapy is really good for working with the muscles, but it doesn't do anything with the disc. When you have a disc problem, when you have sciatica, you have a disc problem. And if you don't resolve the disc problem, very often the problem will come back. Same thing with injections. The goal of the injection is to decrease the inflammatory process. It doesn't solve the problem in the disc. Now, 30% of all sciatica will not go away. So if you have sciatica and you're not getting better, it's not uncommon that you have sciatica and it doesn't get better. 10% of all people with sciatica end up getting surgery. Why? They get surgery because all the other treatments didn't work, because the problem was in the disc. Very often the goal of the surgery is to cut the disc out. They call that a discectomy, to take the pressure off the nerve. Or they'll cut out part of the bone. They'll cut out the whole back end of the bone. That's called a laminectomy. The goal is to free up the nerve. The problem is it's not very effective. And it's not uncommon that you have one surgery and you end up getting a second surgery. And probably the most advanced surgery and the most common for a sciatica is the fusion surgery. Not a good idea. So what do we do? What makes our treatment better? Okay, we'll talk about the study tomorrow, but I want you to at least understand where this is coming from. What makes us better? We solve the problem with the disc. The key to sciatica is freeing up the space where the nerve is. That's what we have the ability to do.